Okay, so for shoulder movements, I had shoulder flexion. The normal range is 0 to 180. The muscles involved are the pec major, the coracobrachioles, and the anterior deltoid. The pec major, the origin is the medial half of the clavicle, the sternum, and the first through 6 ribs. The coracobrachioles, the origin is the coracoid process of the scapula, and the insertion is the medial surface of the mid-humeral shaft. And then anterior deltoid, the origin is the lateral 1/3 of clavicle, acromion, and spine of scapula. And the insertion is the deltoid tuberosity. And then I had shoulder external rotation, and the normal range is 0 to 60. The muscles involved are the posterior deltoid, the teres minor, and the infraspinatus. So the posterior deltoid, the origin is the lateral 1/3 of clavicle, the acromion, and the spine of scapula, and the insertion is the deltoid tuberosity. The teres minor, the origin is the upper 2/3 of the spine of scapula, and the insertion is the greater tubercle of the humerus. And then the infraspinatus, the origin is the infraspinous fossa of the scapula, and the insertion is the greater tubercle of the humerus. So for scapular movements, I had scapular downward rotation, which involves the pec minor, the levator scapula, the rhomboid major, and rhomboid minor. So the pec minor is the 3rd, 4th, and 5th ribs, is the origin. The insertion is the medial surface of the coracoid process of the scapula. Pec minor. Levator scapula is the transverse processes of the 1st through 4th cervical vertebrae, and the insertion is the medial surface of the scapula. And then teres major is spinous process T2 to T5, and the insertion is the medial border of the scapula. And then rhomboid minor is the origin is the spinous process C7 and T1, and the insertion is the upper portion of the medial border of the scapula. So then I had scapular depression. So we have scapular elevation and then scapular depression. The muscles involved are the pec minor, serratus anterior, and the lower trapezius. So pec minor is the 3rd, 4th, and 5th ribs. The insertion is, the origin is the 3rd, 4th, and 5th ribs, and this insertion is the medial surface of the coracoid process of the scapula. And then pec minor, serratus anterior is the upper 8 or 9 ribs, is the origin, and the insertion is the anterior aspect of the medial border of the scapula, or lateral border of the scapula. I think it's lateral border of the scapula. And then the lower trapezius, the origin is the spine of the scapula, and then spinous process T12, and then the insertion is the lateral 1/3 of the clavicle, the acromion, and the spine of scapula. Okay, I think that's right.